Discomfort between the shoulder blade and the mid-back is a common symptom experienced by our students and office workers who are often in a sustained sitting position. Today, we're going to show you 3 strategies to fix this problem once for all. So a common cause of mid-back discomfort is being a sustained sitting position while having a poor posture. For example, typing with your shoulders rounded and arms forward. The problem with this position is that the rhomboid muscle, which is between the mid-back and the shoulder blade, will be on a constant stretch. So imagine the rhomboid muscle being an elastic band. If the elastic band is on a constant stretch, the band will become really long and weakened. So the same thing could happen to your rhomboid muscle. When your rhomboid muscle is on a constant stretch, over time, your positioning of the shoulders will become excessively forward, and that can lead to problems such as mid-back discomfort. If things progresses and your shoulder continues to be in this rounded position, what can happen is your neurovascular structures, so the nerves and arteries, will become compressed. And that could lead to symptoms such as numbness and tingling sensations, as well as weakness around your forearm and even your fingers. So the question is, how can you get your shoulder back into a more optimal position? Now the answer is pretty simple. All we need to do is to strengthen this weakened and overstretched rhomboid muscle. So the action of the rhomboid muscle is shoulder retraction. So basically, imagine your shoulder blade squeezing into each other. One simple exercise that you can do at home is some rowing while in a bended forward position. So now you're going to find a chair, lean forward, then move the water bottle upward, then slowly coming back. So the key is really to imagine moving your shoulder blade towards your spine. If you find that the weight of the water bottle is not enough, you can simply add some water to increase its weight. So how many repetitions should you be doing? In terms of optimal strengthening, you're going to find a weight where you can only do 6 repetitions. If you're just starting out, my recommendation is to start at 12 repetitions. And once you start to get used to the exercise, your muscles get stronger. You could now progressively lower the repetitions to 6 repetitions while gradually increasing the intensity. So another cause of mid-back discomfort is restriction of the thoracic spine. And this is especially common among our office workers who often sit at one place for hours. You could probably imagine, without movement, there will be a constant pressure acting on the spine. And even the muscles around your back will become more tense and tight. And these factors together could lead to mid-back discomfort. So our thoracic spine has 2 primary movements, flexion and extension, as well as rotation. So in order to fix this flexion restriction, we can do a simple exercise called cat-camel. You're going to go onto all fours, arch your back, then let it drop. So the benefit of this exercise is that you can actually relieve the sustained pressure which has been building up on your spine. And with movement, our body can also release the synovial fluid, which acts like a lubricant to make your joint movement to be much more smoothly. If you're also experiencing neck and back pain, then this exercise will be perfect for you because your spine is interconnected. So this exercise essentially can relieve all the stress from the entirety of the spine. So for our next exercise, it's going to target this rotation restriction. You're going to go into a half kneeling position. Then move your arms and head to the opposite direction. The key is really to keep your pelvis squared. Otherwise, you're simply doing a hip rotation rather than a thoracic, a trunk rotation. For those of you who have stayed to the end of this video, I just want to show you my appreciation by giving you a bonus strategy. So you're going to grab hold onto a tennis or lacrosse ball. Then you're going to position the ball onto an area where you're having the most severe pain. So there are 2 ways to do this. First, trigger point release. You're going to press the muscle belly towards the ball and hold it for 5 to 10 seconds before letting it go. So the second way to do this is roll a lacrosse ball up and downward along the muscle belly between your shoulder blade and the spine. If you want to add more pressure, simply step forward. If the intensity is too much, then step backward. The key here is really to avoid direct pressure to any bony areas, because our target is really at the muscle belly where your discomfort is at. So the benefit of the self-massage is will help relax your tight muscles, increase the blood flow towards the area which will help facilitate healing, and most importantly, reduce your pain. So there you have it, 4 strategies to reduce your mid-back discomfort. I hope you got some benefit from today's video. If you want to learn more about rehabilitation and healthier living, then make sure to smash the subscribe button. Thank you for watching. We will see you next time.